Schizophrenia. The term schizophrenia literally means split mind. However, when Eugene Bleuler coined the term in 1911, he was referring to the fragmentation of thought processes seen in the disorder, not to a split personality. Unfortunately, popular media has often confused schizophrenia for multiple personality disorder, or dissociative identity disorder, a syndrome in which a person manifests two or more personalities. Schizophrenia is a much more common and altogether different type of disorder. Schizophrenic disorders encompass a class of disorders marked by delusions, hallucinations, disorganized speech, disturbed emotion, and deterioration of adaptive behavior. Although no single symptom is inevitably present, these symptoms are commonly seen. There are 5 subtypes of schizophrenia. Catatonic schizophrenia is marked by striking motor disturbances, ranging from muscular rigidity to random motor activity. Patients may remain motionless for long periods of time or become hyperactive and incoherent. Some alternate between these dramatic extremes. Disorganized schizophrenia is diagnosed when a particularly severe deterioration of adaptive behavior is seen. Prominent symptoms include emotional indifference, frequent incoherence, and virtually complete social withdrawal. Aimless babbling and giggling are common. Delusions often center on bodily functions. Paranoid schizophrenia, as its name implies, is dominated by delusions of persecution along with delusions of grandeur. In this common form of schizophrenia, people come to believe that they have many enemies who want to harass and oppress them. They become suspicious of friends, relatives, and often of mysterious unknown persons. Undifferentiated schizophrenia is marked by mixtures of schizophrenic symptoms, people who are clearly schizophrenic but cannot be placed into any of the 3 previous categories. Residual schizophrenia is generally diagnosed when the person is no longer actively displaying schizophrenic symptoms. They may continue to experience hallucinations or delusions, however they have diminished significantly. Prevalence estimates suggest that about 1% of the population may suffer from schizophrenic disorders. That may not sound like much, but it means that in the US alone, several million people may be troubled by schizophrenic disturbances. In fact, schizophrenia is among the top 10 causes of disability in developed countries worldwide. A combination of genetic and environmental factors play a role in the development of schizophrenia. It is clear that genetics plays a key role in determining whether an individual will develop schizophrenia. Siblings of schizophrenic patients show a risk that is 9 times higher than normal, nieces and nephews 4 times higher, and cousins 2 times higher. This pattern is consistent with the hypothesis that genetic inheritance influences the development of schizophrenic disorders. However, people do not directly inherit schizophrenia. Rather, what they appear to inherit is a certain degree of vulnerability to the disorder. Whether this vulnerability is converted to an actual disorder depends on each person's experiences in life. Environmental factors associated with the development of schizophrenia include the living environment, drug use, and prenatal stressors. Recent research has suggested that marijuana use during adolescence may help precipitate schizophrenia in young people who have a genetic vulnerability to the disorder. Other factors that play an important role include social isolation, racial discrimination, family dysfunction, unemployment, poor housing conditions, and immigration related to social adversity. Abnormalities in activity at dopamine synapses have been implicated in the development of schizophrenia. This is known because the therapeutic drugs that tame the symptoms are known to be dopamine antagonists that reduce the neurotransmitter's activity. Schizophrenia today. While there is no known cure, schizophrenia can be quite effectively treated, primarily by antipsychotic drugs. These drugs gradually reduce symptoms by decreasing activity at dopamine synapses. Studies suggest that antipsychotic drugs reduce symptoms in about 70% of patients, albeit in varied degrees. When they are effective, they work their magic gradually.
Imagine if we could shrink down to the size of a molecule of dopamine or one of these first-line antipsychotic agents. What would we see down there at the molecular level?
As the dopamine is released by the dopamine nerve cells at 5 times per second in great pulses, the dopamine molecule then arrives at the receptor area, just 100 angstroms away, and it goes on and off the receptor very, very quickly, perhaps as many as 1,000,000 times a second. And in the presence of an antipsychotic like haloperidol, the access to the receptor by dopamine is blocked. So there's a competition between haloperidol and dopamine. And in this case, haloperidol, being tightly bound, wins the competition, and dopamine transmission is partly blocked.
The prognosis of schizophrenia is varied at the individual level. Schizophrenia is a major cause of disability. Approximately 3/4 of people with schizophrenia have ongoing disability with relapses. However, some people do recover completely, and most are able to live independently and function well in society with community support. The key to successful recovery is early diagnosis and treatment. In general, the earlier someone with schizophrenia is diagnosed and stabilized on an appropriate treatment regime, the better their chance of recovery. In light of this tendency, anyone who suspects that they, or someone they know, might have signs and symptoms consistent with schizophrenia should consult with a psychiatrist at the earliest possible convenience. Thank you.